on. All right, so it says
I'm
that we're
live.
live.
Woo!
Hey, Dr. Susie, how you doing?
I'm doing great. I got my pelvis.
Well, let me introduce myself and then go back to pelvis. So, hey, everybody, for whoever's watching or will be watching, my name is Mike, Uptown Mike. I live in Japan. I've been, can't say suffering because I'm not suffering, but I've been having chronic pelvic pain for the last, I guess, 2-3 years. I'm doing great. I have my own ways to recover. And I met Dr. Susie, which is a great, great, great doctor. And we're doing a monthly or semi-monthly podcast about chronic pelvic pain. Dr.
Yay!
Susie, you
So
want to introduce
glad.
yourself?
Yes, you did a good job. And most of our viewers probably know who I am by now, but I'm Dr. Susie G, and I'm a doctor of physical therapy. I have a board certification in pelvic rehab from 2 different institutes. And I've been doing this for the past 7 years now. So, and my specialty is really working with men who are struggling with pelvic pain, but I also work with women. We have the same parts, just organized differently. So everyone needs a little bit of love.
And you're also, you also were suffering it from before, right?
I have, yeah. So this was actually while I was learning pelvic health and getting into it, I started to realize that I've had some of these issues, but never really thought to bring them up to anyone because it's embarrassing. And also, like, you think you're the only one that's dealing with it. Like peeing in your pants when you're jumping on a trampoline.
Yes.
Yeah, that happened to me when I'm 23 years old. Like, and so it sucks when you're dealing with that. You think that there's something wrong with you and no one else is, dealing with these similar things. And when in fact they are, we're just suffering in silence. So as I was learning the ropes and helping others through their own experiences and through my own experience, I was able to deal with painful intercourse and change my life and my lifestyle to get myself better. But I had to kiss a lot of frogs. You have to go through, the challenges and tribulations of seeing providers that are well-intended, but just don't know how to help you. And so through my own experience is why I'm doing this with you and trying to spread the good word about there is help for this. Sometimes it's like winning the lottery, but once you find that person, you're really set up for a truly great roadmap to your recovery.
Yeah, that's why we're doing it. The whole purpose is doing it because it is, how you said, kissing frogs. We all had experiences where we met so many doctors and they're telling us, hey, this is what you have, deal with it. And there's nothing else. And, feeling lonely and without any support is one of the worst feelings in the world. So
it totally
that's why
is.
we're here.
And not even just doctors, but sometimes, I hate to say it, but even family members, like, just deal with it. They get tired of listening to your problems and they're just like, well, there's nothing you can do. You're just going to have to deal with it. Right.
Mm-hmm.
And that can be really tough. It's one thing to hear it from a professional, but when you're hearing it from your own family members and friends, it's just, you start to feel like you're a burden to everyone. And it's just not a good place to be in psychologically, mentally, physically. It's you're just digging yourself in. But there is light at the end of the tunnel. Me and Mike here are living, walking, talking proof that it can be possible. It takes a lot of work. It's not easy, but if you stick with it and you work with it, it will transform your life.
I think that's what was one of my favorite things when I read your book was, like, right off the jump, it was like, you will get better. There is light at the end of the tunnel. And that is so reassuring because when you read stuff on the internet, is usually super negative and it's people just suffering, like something we mentioned before, that there's so many people who are commenting when they're negative, but when they get positive, they say nothing. So it's all this negativity, all this negativity on the internet.
Well, you know how they say that misery loves company?
100%. It really does. Nobody wants to be in the bottom by themselves.
No, right. Again, and that's okay. But if you're both bottom feeding on each other and dragging each other down, that's not a good thing. And sometimes you gotta cut it off. Like, you gotta cut that off.
Just to bring back in full circle. So where's your pelvis
Oh, hey, I dropped my pelvis.
You know, this is something that I wanted to. I think I mentioned in the other one. I'll probably mention it forever. But the thing I loved about your video was when you took that thing out and you're actually touching it, and you brought the body over. That gave me like, it doesn't matter how many times that you see the pictures and just seeing it, it made a world of a difference. I always mention it because I remember even the holding the pelvis, I was like, where is that? How does that fit especially when you do the internal stuff?
Yeah.
But when you brought out the guy, and I was like, all right, that was like one of the best things in the world for me, by the way. I was like, finally I get to see it, because reading in the book was, I guess I'm dumb or dyslexic or something, I don't know, but it wouldn't click in my brain.
You just learn differently. That's how we all learn differently. Like I learn, I have to be in person in a classroom, hands on in there, like training on the job. I need to have somebody literally, I need to see it, I need to hear it, and I need to touch it. And
the holding of a hand thing. I'm the same way. But once it sticks, it sticks in my brain forever.
Yeah, like riding a bike, right?
Yes.
You never forget.
It's kind of crazy. We have 7 viewers. Hey, 7 viewers. I don't think I don't know. Can we? No, the chat. I don't know. It's only a chat between you and me. We got to figure this out for next time. All right, doctor, let's get into the new batch of questions. So
cool, let's do it.
First question is, does weather affect your condition?
And whoever asked this question about weather and pain or your condition, it's a great question. And I get this question asked a lot. So your body, our bodies, have various different sensors that all have a job. Some of these sensors detect pressure. Some of these sensors detect temperature, stretch, vibration. You get the drift. But they all report back to the brain and provide information. With weather change, those same sensors are detecting a change. That's all that they're detecting. So temperature might be getting colder, might be getting warmer. The pressure in the atmosphere changes. When we get cold, we get the signal, we put on a sweater. When we get too hot, we take layers off. But with pain, the nervous system is a little bit more sensitive, and it's going to pick up on the subtle changes that can set off those alarm bells quicker. Not because you're in danger, but because there's a change in your environment. And this change in your environment might send off those messages, increasing those alarm bells, making you feel like there's more pain. So does weather directly cause pain? That's really questionable. And I would say biologically, no. But can it have an influence on what you're feeling? Sure. But just based on that biology of those sensors just picking up on information. Okay. So there is no cause and effect with that. That's what I can do to answer that question.
I was trying to think of it's if weather does affect me, but I was thinking of it more as in when you're in a somewhere warm, I feel, you know how your muscles can stretch out more?
They're relaxed.
So I feel like, they're relaxed more. So that's the only thing that I would really say that it affects me, is more like when it's in somewhere warm. Like here in Japan, we don't have central air, which sucks, because when you get home, it's freezing cold. So we have everything on, and we also have like electric blankets and stuff. And when I'm in the electric blanket, I just feel more comfortable compared to when I'm in a cold environment or sitting in just a cold chair.
Right. And likewise, I'm definitely a warm person, but there are some people that are heat, they just don't like the heat, or they don't like things to be warm. Or maybe the tissues themselves, because the nerves at that tissue level, they can backfire. They can release chemicals that can actually change like your tissues, the texture, the temperature, the sensitivity, if they're swollen or not, right? So like, for example, if you've sprained your ankle and it's swollen, then you're not going to want to have heat, because heat would make things feel worse, right? It's all a matter of, well, what's really happening for you and your body, and what makes you feel good, right? And does that make sense for you? So for some people, heat is very comforting and very warm and like makes you relax. And for others, depending on their situation, heat or temperature or increasing it might not be the greatest thing. It might make things worse for them.
Sounds good. Let's move on to number 2. Why is my urine hot?
So your urine, it is supposed to be warm because it's coming out of your body, right? I would be more concerned if it was cold. But your internal body temperature is 98 point something 6 degrees Fahrenheit, and I think it's 37 degrees Celsius, if I'm not mistaken. But also to note that when somebody's perceiving something to be hot or cold, that varies based on that person's context and their universe.
Okay.
So for example, let me cite a study here. Lorimer Mosley and his pain research team, they did a study testing people who don't have pain to determine if the cues they were given changed how quote unquote painful the stimulus was. So here's what they did. They took a cold probe. So they took a cold probe. At the same time, they put it on the back of someone's hand and they showed them either a red light or a blue light. And they weren't told anything. They were just given the cue of red or blue. When they were asked how much it hurts, it didn't hurt as much with the blue light on than it did when the red light was on. So you get me? So red usually means like bad, painful, like the context that you bring to red. If something is blue, it's like cool, it's not going to be hurtful, right? The probe didn't change. The probe was the same temperature, but when those people had the red light on, they reported experiencing more pain. It also changed whether or not that person was directly looking at the stimulus. So if they were looking at what was happening in their body, that visual cue changed the outcome of their response. Does that make sense? So in terms of this hot cold thing, urine is generally warm or hot, right? Because it's in your body, that's your body's temperature, and it's a normal thing. But whether you as a person perceive something to be hot or cold depends on the context of the situation.
When I saw this question, I've seen it I've seen it a lot, and I think I don't think they mean hot. I think it's kind of like, I hate to say it this way, but like a spice to it. Like, you ever ate something really spicy and then you go number 2 and it just burns? I think that's what they mean, because when they said it, I noticed, I would say like a handful of times the last 2 years, I felt like, whoa, that was like, I felt like the spicy feeling, the same that you would when you would defecate. I think that's what they mean. And and I've felt it very slightly. And I remember when I had it, I was like, I do feel it, but it was so slight. And I was trying to think of, what did I eat that would cause this? So I would like bounce this question back to you. If it's a sensation like that, what would this cause it? Or if this wouldn't, what do you think would cause it? Or you would have to come back next time with that answer?
Well, no, I mean, it's a good question in terms of this. Again, when someone experiences something, I just don't know exactly what you're feeling, like in that sense, what you're feeling. Because what feels hot for me in terms of spicy or like that burning sensation, right? It's even hard to describe. Like you're struggling just to describe it because it's such a personal experience.
True.
There's so many things that can interplay with that in essence. Like maybe it was something, or maybe it was because you were having more of a stressful day, or maybe they just had a cystoscopy and they had a catheter put in. Sometimes the catheter can brush against the urethra, and that creates a little bit of burning and pain, and that will heal over time. But if you're already sensitive, that just makes things even more sensitive. So, again, it depends. It could be bacterial related, right? Because bacteria live in everything on our body, like our cells, our hair, our nails, they're everywhere. They're living organisms. Maybe it has something to do with the bacterial flora in the urethra. So I can't really answer that question like definitively. I just know that it could be multiple different things that can cause that, or nothing that can cause that.
Okay. But you were saying it's basically a personal thing.
Well, definitely personal in terms of what you're experiencing. It's very real and it is very personal. Yes.
Okay. All right. Next one. The most common, does masturbation affect it? I've heard this so many times. And before you say anything, I'll give my personal thing. Does masturbation affect it? yes and then no, because
Mhm.
I do, if I have just regular intercourse, I don't feel any soreness, but there is sometimes soreness after masturbation, but it's more what what I say is more to do what I do after the masturbation, because sometimes like you just do it, you don't relax your muscle or whatever, and you're still tense and you feel it later. And it, usually for me, it's like 1 or 2 or 3 hours later, but I don't feel it all the time. So I would say it does affect me, but this is gonna sound like the craziest thing I'm gonna say on the internet, but it doesn't stop me from doing it.
Right.
That's what I would
Okay.
say.
We endure what we want to endure,
Oh
right?
my god, I can see
There's
this
good reason for it.
going viral now. It's like, oh yeah, this guy admits being off, doesn't care that his penis fucking is sore after being off. But here we go.
Well, I mean, think about it. You're exercise. So that's you're flexing your sex, right?
Mm,
You're exercising. And you have muscles that exercise. So that's why I brought my pelvis today, because I,
mm,
I think having a visual of where these muscles are and how they aid in sexual function is really important. So during an erection, okay, these muscles, they have to tense and clamp down on the base of the penis to keep the blood flow inside the penis.
mm-hmm.
Okay, but it is a neurochemical reaction that actually initiates, like the nervous system is in control of whether or not you're going to have an erection, and then it cascades. So during masturbation, your genitals, your penis, is filling and engorging with blood and also increasing the pressure. So tissue has to stretch, okay, and has to increase in pressure. When somebody's sensitive already down here in this area, and again, those sensors are picking up on this change, it might be enough to just push someone over the edge. The other thing is that when you are ready to ejaculate, these muscles have to pump. So they contract and they relax like really quickly. It's been said anywhere from 8 to 12 times that they do that during an ejaculation, but to help push the fluid out, right? So to help push fluid, urine, whatever. So they contract, okay? Not urine, because it's not doing that
I was
when you
about to say I didn't want I didn't want to
I
cut
take
you
that
off,
back.
but
It's not
it's
urine. No.
sperm. Yeah, yeah. Be
Yeah,
scientific
it's
about it.
semen. Yeah.
Yeah, yeah.
So, but in any case, so that when afterwards there should be some resolution. But like you said, if you're not like relaxing or breathing to help calm these muscles down, and you're just going back into your regular day and not like recovering, right? So you worked out these muscles and then you're not recovering, it could pose for soreness.
Yeah, that's
The
what I
other,
think.
yeah, and the other thing is frequency and how often you're doing it, and the reasons why behind it. Sometimes I feel like there are men who use, because it gives you a little bit of that like relaxation effect due to the nervous system. So it might help with anxiety for some guys. And if you're doing that compulsively to help with diminishing your anxiety temporarily, that's probably not a good habit to get yourself into. So, that's what, again, going behind like, well, what is, why is it pleasurable for you and you enjoy it? Or are you doing it for other reasons? And also the dosing, like how frequently are you doing it, right?
Yeah.
What are you doing afterwards? Like, are you giving yourself some downtime? And then while you're masturbating, let's not forget the context of which one is pleasuring themselves. Like, what's your environment like? Like, do you feel safe when you're masturbating in your house, or are you in your bathroom and you're sharing it with like 5 other people and you're rushing to get out of there? Like all of that can or keep you calm. So it just depends. And also on that note of ramping up and ramping down, I forgot to mention that to get an erection, you have to be in a very calm, parasympathetic, rest and digest kind of state, right? That calming part of the nervous system. When you ejaculate or are ready to have an orgasm, the nervous system, the mechanism switches to ramping up. So that makes sense, right? So you're ramping up, you're ready, things are gonna,
Yeah.
fireworks, right? Rocket launch. That switches, and that's a good switch to have because you need adrenaline and norepinephrine to, like tell your boner that it's done. Otherwise you'd have an erection for hours, and that's what Viagra and all those medications do, is they help, they stop those chemical reactions from taking away that nitric oxide. They keep nitric oxide in the tissues to help maintain that blood flow to keep going. So, again, it's all about the nervous system. So if you have soreness after you masturbate, I would look at, well, how often are you doing it? Maybe you need to dose back just temporarily, okay? Just like you would be working out for bodybuilding or training for a marathon. If you have an injury, you're not going to go back to running your marathon full force. You're going to build up to it, right? You're going to train, you're going to go slow, build up, get your strength, and then do what you need to do to run that marathon. Does that make sense?
Yeah, I what I was gonna say, just on jumping off, piggybacking off of you, I was gonna say after you do it, relax for like a minute or two, breathe out, try to do a quick stretch, and then keep on your day. I think you'll notice whoever's doing it. I think they'll notice it. It really will make it'll totally make a difference, because I think most people are just jacking off and then either not going to sleep or just going on their day, and then all of a sudden you got to forget that you really just tense up your muscles.
Yeah. So it's how you're doing it, and then give yourself some recovery time. Like you said, that was a great example, Mike. Like, breathe before you go to the next thing. Just like acknowledge
just chill out that you just busted a nut. You were just like, oh yeah, I'm done. Back to no.
Yeah, right.
I just kept thinking like they're in the shower, like they're in the bathroom busting a nut, and then go back outside like nothing ever happened.
Right. Yeah. Like, take some time that you had experienced that moment. It feels good for you. Like, absorb that moment. Don't just like, go into autopilot. And
don't go make a sandwich or something.
Yeah, right. It's not just with masturbation though. Like, let's not kid ourselves. It's also with like everyday things.
Yeah,
like,
even the toilet is the same thing.
Right.
If you go to use a toilet and then you rush out something, that is, I think it's more than masturbation bothers me the most, when like I have like a class and I gotta run to the toilet and run back out. I always feel I have to, like, in the middle of the class, just breathe and just calm down, because it always bothers me. So that's what I say, people, just calm down after you do it.
Exactly. Same thing with eating. You're supposed to eat calmly, because if you're eating fast and you're on the go, you're not really giving yourself time to digest, and you're not giving your body the signal of like, oh, this is time to rest and digest. You're going. Blood flow, when you're in that state of like upregulation and just Energizer Bunny, blood flow the circulatory system changes, your breathing pattern changes. Blood flow is being diverted from your gut, from your stomach, from your intestines, from your pelvic organs, to your heart, to your lungs, to your brain, and to the bigger muscles of your body, just naturally, because you're on the go. Like, there's no time to think about pooping, peeing, or sex, or like let alone eating, So again, you're right. Like, calming things down, ramping yourself down. It's okay to go up, but always come down and find that balance in your day.
Yes, totally. Number 4, turmeric. Does turmeric cure? So like I was told, and everywhere you search online was turmeric, however you say it. And I have a bottle. I finished it. I felt nothing personally. But what do you say?
So turmeric is marketed very well. And like you, I would bank on many other individuals having the same experience, that it really didn't do anything. Nothing is a guaranteed cure. And if you are looking for help, my best word of advice, if somebody's guaranteeing you a cure with something they're selling or whatever motive they have, run in the opposite direction. Just run, because there's nothing worse than being promised a cure and help, right? It's like, it adds to the overall frustration, hopelessness, and helplessness, which, guess what? Is not going to do you any good for your pain, and it's actually going to ramp it up. Okay? So on a side note with that, supplements, they're very tricky. I think basically they're not really regulated as the same standards as pharmaceutical drugs are, which means that there could be a lot of crappy ingredients in those things that you're taking that you're not aware of, because they're not regulated, and they really don't have to state the fillers in there. And you don't really know if the product itself is a therapeutic grade. So if you are going to go for a supplement, make sure that it is from a locally sourced company, and a company that you can truly, like, do your research on this company that you can truly trust, okay? Or find a practitioner that works for a company that you can truly trust. The other thing too is, like, a lot of doctors like to sell supplements out of their office. They're getting a kickback from from there too. So, I mean, just be an educated consumer and just be aware that although the intention is meant to help you, there might be another motive behind that intention to help you as well. So just be careful with that, with anyone trying to sell you something.
But as of right now, there's no medical proof, right?
There's no medical proof. No. I mean, there's, you know, there are some research done on it, but again, not enough to show what are the right doses, who are the people that are actually, you know, what type of diseases are really benefiting it. You know, what are the absorption rates in somebody's body? Because we're so unique that it's really hard to show like what exactly it's really doing. It's not just in a vacuum. That's the problem with a lot of research studies. It's not in a vacuum. So we definitely need to have more evidence. We definitely need to know what the clinical therapeutic effects are for turmeric. And in my humble opinion, I think keeping things really simple, like just eating a well-balanced diet, sleeping, managing your stress, and daily exercise is going to give you all the boost that you need to maintain your health.
Yes.
So there isn't a quick fix. No cure in a bottle.
Just because I've been watching way too much, I've been listening to much podcasts. That's a good segue. You said dieting, right? And we're talking about the turmeric. So just to jump on, pseudoephedrine and flower pollen, it's the same category, right?
So pseudoephedrine is actually, they call it a sympathomimetic, meaning it mimics the nervous system, sympathetic fight or flight. It ramps up your nervous system, and they use it in methamphetamine, right? So if you're in pain, the chemicals released during the same process, this mechanism of fight or flight, the sympathetic nervous system, it could amp up your pain during or after. It might temporarily take it away too. At that same token, it might, but the aftermath, the byproduct of those things metabolizing in your body could eventually sensitize things. So if you're a person that's already ramped up and you're nervous and you're tense, taking pseudoephedrine increases your nervousness and increases your muscle tension, and also it affects your bladder. So pseudoephedrine can increase, you know, a little bit of like overactive bladder or urinary retention,
which I hate.
Right. So, you know, it's kind of like you're getting a jolt and you're like, I had like 10 cups of coffee kind of feeling, you know, that's just how I can explain it. And it can also like make your other organs work harder, like your liver, your kidneys, like I mentioned, your bladder. So that's pseudoephedrine. As far as pollen,
which extract, I also took, I felt nothing.
Sure. Okay. So fair enough. Valid point. For pollen extract, not many studies have been done. And those that have been done have a really low sample size, meaning that, you know, maybe they tested it on 24 people or 30 people. And they include, like, between those people that were tested, there's a lot of variability between the test subjects. So they're not all homogeneous. They're heterogeneous, meaning like you really don't know the effects on all these different people and all their different cases and what they're going through. So it's really hard. It might be beneficial. They're, you know, again, they're speculating there might be some benefit, but as far as right now, we really don't know if there's any therapeutic benefit or clinical relevance. There just needs to be more research done. So,
because everywhere that you look on the internet, from what I saw, and even what I was told was it was both. It was like you got to take turmeric and you got to take flower pollen. That was like standard. And I saw, and there was a bunch of places like this is the cure, blah blah, etc. But this is going to lead to something else. But I'm going to go back to the dieting, raw dieting. Does it help or doesn't it?
So I think we mentioned it in our last Q&A back in December. And I'm going to just piggyback off of my response from there, is that diets can be helpful as long as you're getting what your body needs. So basic thing like good fats, which we know are needed for brain and nervous system, proteins, minerals, and vitamins. You know, and also looking at, are you getting variability in your diet? Or are you eating the same thing over and over again? Because that in itself is not a well-balanced variability. The other thing you should ask yourself when you're trying out a diet is, how is this making me feel? You know, because if you are drastically going to change your weight, let's say by changing your diet, your weight changes. Well, that fluctuation, if it's drastic, again, that could set off your alarm bells and increase your pain.
Mm-hmm.
So dose everything, taper things, as you're trying them. Don't just go, full force, because that in itself requires your body to have enough resilience and have enough balance to maintain those changes, or to maintain any rebound effect from those changes, so that things could eventually balance out. But what happens is people try things and they try them for a short amount of time, they feel terrible, and then they get off, and then, again, you don't want to do anything full force. And when you're getting off of something, this includes meds, you don't want to get off of it cold turkey either.
Yeah.
Because there might be a rebound effect. So just be aware of that. Like, anything going in, anything coming out, there's got to be this balance, and only you know what that makes you feel like. So there could be a lot of recommendations. It's just a matter of, how is it making you feel? And if you feel like you're depriving yourself, or you're not getting enough nourishment, then I'm afraid that's adding more stress and more fuel to the fire. That's my opinion.
Yeah, totally. And just to go back to what we were saying, what I was saying was, everywhere on the internet says take the turmeric and to take the pollen, but this is fighting prostatitis. So let's get into the other question: is what's the difference between chronic pelvic pain and prostatitis? I should be a host, man. I'm doing a good job. What's going on?
You're doing a good job. I'll just make a quick comment on when you mentioned fighting prostatitis.
Mm-hmm.
Even in those cases, it has not been shown to be clinically beneficial. Because, as we know, and we'll get into this question, that prostatitis is actual infection in the prostate is very rare. It's actually less than 5% of the cases. So up to 90% are not due to an infection at all. So they are used, prostatitis and pelvic pain are used interchangeably sometimes, like when you're reading things. But prostatitis is like a misnomer almost. It's like fake advertising. Usually, in the name itself, like if you just take the name, it will mean inflammation of the prostate.
Yeah. And there was a, sorry to cut you off, but there was a Japanese doctor that I went, it was kind of hilarious. He said on the internet, you don't have prostatitis. That's what they just give you because they really just don't know what else to say. And it's kind of like, he called it the wastebasket of the whatever area. Like all the doctors like, oh, that's what you have.
Right. Well, guess what? Because you have to code a diagnosis. And this is why I hate labels, because you have these codes for insurance companies, and insurance companies need to have codes. And sometimes we don't have codes for something that's going on in somebody's body or what's going on. So it's an umbrella term. When, people got to put something down to get paid. So prostatitis is an umbrella term that is a code that is typed in so that insurance companies can pay. Okay, so it's in the name itself. It literally means inflammation of the prostate, itis, inflammation of the prostate. But like I was saying earlier, we know from the evidence that most cases of pelvic pain are not due to an infection. Up to 97% are not due to infection, which means that less than 5% are actual infection. Okay. There are men who have signs of inflammation in their prostate, but have no symptoms. I mean, that's a category in itself, asymptomatic prostatitis. So again, thinking about that logically, inflammation is not always the cause for pain.
Yeah.
And actually, inflammation gets a bad rap. Inflammation is a good thing. That means your
protection, right? It's fighting.
Yeah, it's protection. Your body is actually doing its job to protect you. So generally, generally in my opinion, if you've gone to get all the red flags checked out, big ticket items, anything sinister, and there is no known identifiable cause or pathology, and you're still having sexual issues, urinary issues, pain issues that are persisting greater than 3 months. So, in the literature, they say anything greater than 3 months that's lasting like that, I would at that point classify that as pelvic pain. So that's my quick and dirty answer for that.
Yeah, I most of the time people are like, oh, I have this. I'm like, I'm not a doctor, but from all the evidence, you don't have it.
Right.
But I'm not a doctor, so there's not much that I can say.
Right. And don't get me wrong, in those cases when there's an infection and they actually find infection within the prostatic fluid, antibiotics are helpful, obviously. But the issue is that antibiotics are given out like Tic Tacs. Again,
They are.
well-intended, by well-intended providers because they're trying to help. But if you've got a hammer, everything looks like a nail. Do you know what I mean?
It is. I'm actually going to use the toilet, and this is not because of chronic. I was just drinking before, and I should have used the toilet before I started this. So just so you can keep going, the next one we're going to do is, while I use the restroom, is I have abdominal pressure and bloating. Is that CPPS? And before you start talking, I would say go to the doctor and ask the doctor. But go right ahead. I'll be back in a second. You can start your spiel.
Question. It's a very short answer.
All right. What's the answer?
So I can wait for you. We can take a little bit of a break.
All right. Give me a second. I'll be right back.
Intermission. Well, and to all of you, viewers out there and listeners, honestly, this is a great opportunity for me to connect with you all and hopefully shed some light on this very enigma of a condition that happens to, believe it or not, a lot of men and women. It's been said that over 2 million outpatient visits in the United States alone are due to pelvic pain related symptoms. So, if there's anything you get out of this, is that you're not alone, that there is hope, there is help, and pelvic pain doesn't have to be permanent. It might be hard and it totally sucks when you're living through it, because it's one thing to be in the shitstorm. It's one thing to be watching the shitstorm from a glass window pane. But know that as a community, and for those of us out there that are really truly fighting and supporting for you, know that there is hope and there is help. So hopefully these Q&As and these webinars that me and Mike are doing will shed some light and to help you guide your recovery better and in the right direction. So that's all I have to say for that. And we will wait for Mike to come back from the potty. I kind of wish we knew what comments and questions you guys have, but I don't have control over that.
All right. And for those curious minds, yes, I did wash my hands. Because I know someone's like, oh, he didn't wash his hands. Yes, I did. All right. Just to this is something that I thought about when I was urinating. Was in your book, you taught something that's been so helpful for me, and I'm just gonna plug this in because your book is amazing, and so is the DIY course. You said when you use the toilet, you have to relax, and I remember reading that before, and it didn't really hit. And then you kind of explain how to relax. Just let go of your stomach and don't force the urine out. Let it come out. You should. It was like 10%, right? It was like just the 10%, and that has helped me urinate so much better than I was before. Because I was, when you force it, just like not trickle, but it's like a shot. But when you just let it, it's a slow stream, and of course at the end you have to kind of shoot it out. But it has helped me so much. So I just want to say thank you. Plug in that book and plug in the DIY course, because there's so
and just
many
so everyone knows, like, I'm not paying you to say that.
No,
and you're not getting any money for that.
Yeah,
just FYI.
Because now there's new regulations. I paid for my DIY course. I paid for my book myself, all out of money. I would even pay more. I always tell people, like, oh, someone asked me, was like, it's $20 or whatever the price was for the book. I can't remember. I'm like, I would give all my money to my bank account to feel better than I was before. And it was like, just do it. But anyway, yeah.
Yeah, good disclaimer. Yeah,
yes.
That's great. So you mentioned abdominal pressure. So on that topic of pressure and pushing and all that, abdominal pressure and bloating, right? And you said, go see a doctor.
Yeah, the doctors don't even help.
Well, it might be gas, so hold on. It just might be gas. So let's not throw the kitchen sink at it. Because when you have pressure and bloating, usually the bacteria of your gut, they ferment gas, like they produce gases. So that's why you fart. It's because these little bacteria are creating gases in your body and you fart. So in any case, abdominal pressure and bloating, they're, as you can know, they're broad symptoms. Like anything could be causing that, and we're just not sure. It just depends on the individual. However, chronic pelvic pain syndrome does overlap or can overlap with digestive issues like irritable bowel syndrome or IBS. So there have been research studies that have shown that those who have IBS have a tendency to have pelvic pain, and those that have pelvic pain have a tendency to have more IBS-like symptoms. Not a cause and effect relationship. We can't say one causes the other, but we know that there might be some sort of relationship. And that makes sense, I think, from a biological standpoint, because if I bring out my pelvis again, on top are your guts. Your rectum sits right behind your bladder. And the nerves that communicate to your organs and to your gut communicate to your pelvic muscles and to that area. So just know that there's a lot of crosstalk and a lot of communication between many different parts of your body that feed back to the spinal cord and then go to your brain. Okay. So it's really hard to pinpoint one specific thing. And I think that's what people get hung up on, because in our current society, things are find it, fix it.
Yeah.
Find it, fix it. It hurts here. It's got to be here. The problem is here. And that is not the case with pelvic pain. And until you start to realize that it is way more complex than just, let me massage you here, let me take this pill, that there are many different processes at play. Again, it could be complex. You don't have to throw the kitchen sink at it. It's just understanding that this is what's happening can actually liberate you from pain. Just knowing and understanding how your body works can be very freeing. So anyway, that's what my answer is to that about abdominal pressure and bloating. So if you do suspect that, know that you could go to the doctor to get that checked out, or digestive, making sure there's nothing else serious going on. And if there isn't, know that, again, it's more of a global, multifactorial process that's happening in terms of what you're feeling. So,
well, I will say this because first, I'll say two things. First of all, like, we are joking and laughing because what we were saying before was there's so much negativity out there. Like, you think that you can't live while having this. Obviously, we still suffer from it. It's not as bad as what we used to, but it's I won't say a daily thing, but a daily thing, because it's always on our mind. So we're trying to bring light to some very serious conversations. So people who get upset of us laughing, like, I'm living my life, and I try not to let this affect me, because if I did, I would just stay indoors all day and I wouldn't do anything. And I'm living my life and having a good time at that.
Right. Well, and here's the thing, Mike, like, we don't know what's waiting for us tomorrow. We don't know what's waiting for us in the now or the next minute. It's not like you wake up one morning and you're like, I just want to have a car accident.
Yeah.
I want to get sick. I want to have this, pimple on my, face. You have a human body. We're in this human world. We're living, breathing, changing dynamic ecosystems. And we can't necessarily stop things from happening to us, but we can surely change the way we respond to those things happening to us.
Yes.
And our response will dictate whether or not we're going to be truly suffering, right? Because there are lots of people who have cancer, who have persistent pain, but still find meaning and purpose in life.
Yes, 100%.
And that's way, like, the glasses are much clearer there, and it's more fulfilling and less exhausting than that energy to being very negative and down on yourself and blaming and just, seeing the world with, dark lenses on. It is really hard. And at that point, it is very hard to get out of it. So I'm glad you brought that up.
Yeah. The second thing that I wanted to say was, actually, I've been to the doctor twice because of that. For like the first time I was in like tremendous stomach pain. I was like, man, this is killing me, and my stomach was making massive amount of noise. And in the middle of the night, I just told my girlfriend, we got to go to the doctor because I don't know what this is, and I'm freaking out. And it was like, and I just had this pain, and went to the doctor, and they actually took an X-ray, and they were like, "It's fine. You probably have gas." And I was like, "What? This pain is caused from gas?" Like, and it was gas. And then
Right.
it happened again in the middle of the night. But I was like, "Oh, I'm just gonna go to the doctor tomorrow." So I went to the doctor, and then he gave me I forgot what he gave me, but I was like, I couldn't sleep because I had this gas. And then the next day I went to the doctor and he gave me these pills and I couldn't sleep because I was fucking diarrheaing for like 24 hours straight from these two
Oh
pills. I
no.
had the worst case of diarrhea. I
Yeah.
couldn't even work. That's how much I was in the
Mm,
toilet. I was like, never again. And then the
yeah.
following day I just went to get a massage. And after the massage, I felt right as rain. Like I felt so
Yeah.
much better. So
Oh
I
yeah.
I I agree with you 100%. I think they overlap a lot, and I think the stretching and all the massages it really helps you deal with that stuff.
Well, yeah, well, because honestly, if you have a lot of gas building up, that just tells me that there's things that are sluggish. But guess what? If you're stressed out and you're worried that your life is coming to an end because you're dealing with something so tragic and life changing, which it is, and
Yeah.
very, very rightfully so. But that's still a threat, and you're not going to be, your gut's not going to be metabolizing things and moving, all comfortably. Your things are going to slow down there because again, blood is being
Yeah.
diverted, electrical, the nervous system is changing, and using different energy for different parts of your body and your brain. So that's why massage and being relaxed makes you feel better, because they're
Yeah.
calming things down and allowing all the processes and all your organs and all the systems to do their thing. So
We Me being an immigrant in Japan, a migrant, whatever you want to call it, living in Japan, we always make fun of the doctors here because you go to the doctor for anything, and the doctor always say to you, "Yeah, it's because you're stressed. Yeah, because you're stressed." It was like everything that you say is because he's like, honestly, we think it's your stress, and like we like to make fun of it and say, "Oh my God, these people don't know what they're doing in the medical field." But truth be told, stress really affects your body. I have a friend of mine who broke out in a serious, crazy rash. He goes to the doctor, and the guy said, "You're just stressed out." And he's relieving the stress and it's going away, the rash. So
mhm.
we definitely gotta be careful the way that we mentally view things in our life.
Yes. Yes. Well, I have the same thing with chronic sinus infections or
No
sinusitis.
way.
Yeah, like if I'm stressed and I'm not meditating and I'm not at least in my week, like giving myself that recovery time to like fill my tank back up, I will be congested, my asthma will be flared up. But if
Wow.
I'm in a state of like, okay, my mind is steady and I'm peaceful, it doesn't matter what I'm eating, I feel great.
Mm-mm-mm.
Like, people try to tell me blah blah. Of course, like if I'm eating cheese and dairy, and I know those
Yeah,
things
yeah.
are inflammatory, but come on, my body should be able to handle like a donut once in a while, and not like
Yeah,
go into
yeah.
this like freak out mode. So I can tell you from my own experience, like I can now have a donut and have a burger with regular bread, not gluten-free bread, and be okay. Like I'm like, holy shit. But that's because it's not just food, it's not just
It's
exercise,
everything.
it's everything. It's your whole lifestyle. And sometimes you got to shift your lifestyle. You got to make that change. Pain is a call for change. It is a
Yeah.
behavior. It motivates you to do something, and you have a choice at that point. What are you gonna do?
100%. The
So
next thing I can't pronounce it right, but it's called the pudendal
you
nerve.
pudendal, you
Yeah,
got it
there you go.
right.
Pudendal nerve. I've seen this a bunch of times.
Hmm.
I'm trying to remember exactly. I was sent a link and they burn it. Is that what they do? Some doctors they burn it so it
Oh,
doesn't
you mean
affect
what they
you.
do? Um,
And like yeah. So
so they can, yes, they can do that. They'll cauterize it. Most often, again, surgeons have their own preference, so I'm not sure in what part of the country who does what and how,
mhm.
but that's last resort. That should be the last, absolutely last resort, and even then, the success rates aren't that great. So pudendal nerve, it is a nerve that supplies your muscle. So can you see my model? So that
Yeah.
nerve exits from your sit bones Okay, so the main part of the branch of the nerve, it comes out of the sit bone and then branches off to go to your pelvic region and to your rectum. But that nerve, guess where it starts from? Your back and the sacrum. So that nerve and all the branches are coming from here, okay? So again, lots of connections, which means if you just sense off that part of the nerve, well, it's still, there's still potential for other neighboring parts or nerves to communicate in that area. The surgery itself is really hard to recover because they have to cut ligaments to open or free that nerve. And that can create tissue changes and stability changes in your pelvis itself. So the person who's getting that surgery definitely needs to know what it involves, the recovery process, and has to be healthy enough to go through that. Just like the prostate, though, the pudendal nerve is also notorious for being blamed for pelvic pain. But in my opinion, I think the pudendal nerve, I mean, we're sitting on it right now. It's strong, it's resilient. Nerves are meant to stretch, to be pressed on. You know, again, they might get sensitive sometimes, but they are pretty strong and resilient. Even for some cases that are true structural causes, it can lead to sensitivity of the nerve, but we know from like back studies, like low back studies, that even those that have had pinched nerves or nerves that look like are completely compressed, those people, there are people that are not experiencing pain just based on that. So it's really hard to say that quote unquote pinched nerves or structural abnormalities or differences, they're not the cause of what is happening. It might be a piece of the pie, don't get me wrong. I'm not saying body mechanics and structure don't play a role. They may, but I think we need to take it with a wide lens view and to really comprehensively put it together for that person. But if we go again pointing at, well, that's the pain, that's the culprit, let's get rid of it, we know that those people, back surgeries included, most of them are still in pain. So surgery is not a fix. We can't go blaming the pudendal nerve. The nerves are sensors that are sending messages up to your spinal cord and to your brain. And with persistent pain, changes are happening at the tissue level, changes are happening at the spinal cord level, and changes are happening in your brain. And those changes are patterns, chemically, neurologically, that influence the output, okay? That influence your experience. So that's what I have to say about that.
That's what she said.
That's what she said.
Because I don't have nothing else to comment on that. Pathogens, DNA tests. I've been asked countless times, have I had DNA tests? Have I had pathogen tests? And I will tell this to everybody who sends me a message. I try to answer everybody once a week at least. Guys, I'm doing really good. I thank you for all the suggestions, but I don't plan to take any DNA test or any pathogen test until there's some kind of research that says that they found something that affects it. I don't see the point in doing it. I also heard that if you take a DNA test, I heard that they can take your DNA and use it not against you, but they have like ownership of against the DNA, like it's in a clause or something. I'm like, I'm good.
Wow. Yeah, I've never done it myself either. And you're right, Mike, that there's not enough to support what those tests would actually do and what normal is. Because the only normal that you have to go against, and that goes for any test, is your own. Like hormone testing, stress hormone testing, like whatever it is that you're testing, like it's going against your own norm. And it's not just the clinical tests that tell you something, it's your story. In addition, the tests are like later. They're just kind of supporting evidence, but really the true diagnosis or whatever you want to call it is coming from that person's side of the story. And the other person is putting it together and really using a wide lens approach to see, what systems are involved and what's triggering. And if we change these and these systems, then eventually the symptoms will go away. So we have to kind of shift from symptom relief to let's get you back to living life, doing the things that you love, And once you start to find confidence in those things again, the pain will eventually subside because you're really, again, building resiliency in the face of adversity. So tests can be helpful, but only if they're taken into context of the person's complaints and symptoms. And I have a good friend of mine who we're going to try to get on the Q&A. His name is Dr. Ralph Esposito, and he's a naturopathic physician and urologist and works in the field of men's health in research and study. He's an educator, but I think he would be good to have on here for a Q&A to talk about all the, pathogens and the biochemistry and the molecular happenings of our body. That is definitely not my forte. I like to work with the people in the clinic and pump you up, get you better, explain some of this pain science, neuroscience is my thing. But in terms of biochemistry, I leave it up to my friend Ralph Esposito. So I think he would be good to have on for a Q&A.
That would. Okay, jumping on the next one. I have fatigue. How do I overcome it?
Yeah, so I don't blame you because dealing with pain is exhausting, no doubt, right? Your brain takes a lot of energy and a lot of focus away from the things that you do in your normal life to pay attention to pain. So practice makes permanent. And that's a good friend of mine is a psychologist, Dr. Shawn Haywood. She said that in a podcast the other day. She's like, practice makes permanent. And that makes total sense. Like pain feeds off of repetition, and the things that you pay attention to make that experience and all those neurological, connections stronger, right? So you can create neurological wiring to feed off of the negativity, to feed off of that attention. It just grows because it's trying to protect you. And anything that's trying to protect you is doing its job, but it's like an overprotective parent, right? Too protection is not cool. Like I need to fall. I need to learn my own mistakes, right? So pain works in the same way. So if we give it that attention and we just pick up on all the negative stuff, well, granted, that's the thing that you're going to be most familiar with. So that's the thing that's going to catch your attention, just like news and drama. Like we're humans. We're prone to look at. There's a car accident on the side of the road. You're not going to look, it's that kind of human nature. That's okay. But it's what are we going to do with those mechanisms and how can we change our reaction to those mechanisms? So that's, again, fatigue when it comes to pain is definitely common. It's not normal, but it's common. And my best advice to overcome it is once you feel safe again in your own body and the brain gets that message that things are going to be okay, then that lingering threat and those danger messages will dampen, and it won't use your attention. It won't use your energy or your focus to focus on that. So you got to work with somebody who really understands the pain game, honestly, and can really coach you and guide you through an individual recovery plan. Like that's my best thing. Like start filling up your tank, do things that make you at least smile or laugh, hang out with people who bring you up and make you feel strong and healthy, like those types of things.
See, when I saw that question, what I was thinking was more like, if you have chronic pelvis pain, without it, the pain itself causing you fatigue, do you genuinely feel fatigue? Like how a side effect of a medicine will cause you to feel fatigue. That's what I thought when I first saw that.
Like if you have pain, will you have a side effect of being tired?
Without the pain, just like the condition of having pelvis pain, would that make you genuinely feel tired?
So
because that's what I thought. I thought it was like, I took it like, I hate to say that we have a disease because it's not like a disease.
It's not a disease.
But let's say this was a disease. Does this pelvic pain, does it cause fatigue?
Fatigue? Well, I think indirectly, like I mentioned, I think it's just an aftermath of just being exhausted with trying so many different things and getting frustrated and pissed off. I mean, let's just think about being pissed off for like an hour or something. I mean, aren't you emotionally drained?
In your face, just keeping like a serious,
I mean, it takes a lot of work. It takes a lot of work, right?
I think it's exactly what you're saying, as to the point where it's just like, you have to keep a positive outlook on it, because I love working out, and people always say to me, "How do you work out every day?" And I'm like, I just don't feel right if I'm not
Yeah.
working out. It brings this joy to me. And if you
Right.
have, like you keep saying, we don't know what they're feeling, and I'm really trying to put put myself in their shoes, like how we were discussing before. Like, you just have to have a positive outlook, because if you're a pessimistic or negative person, I feel like pessimistic, negative people just feel tired. They have this fatigue all
Mhm.
the time. They don't want to continue. I don't see how pelvic pain. I never felt tired from pelvic pain, and I felt pain from it, but I never felt like it was more like a, a an exhaustion from frustration, just like how you were
Right.
saying. That's more than anything else. But I know exactly, going back to your book, like how, if, like, I could be having like the worst day and something just positive happens, you forget everything. You
Mhm.
automatically just, the pain, when you, oh shit, I wasn't in pain during that time.
Yeah.
Like, what was that? And having that mindset when you do feel that fatigue, listening to, whatever it is that you listen to, or just doing something that's going to change your mind, I feel like would help this fatigue that the person was asking
Yeah.
about.
Good job, Mike.
That's what I think. The next
Yeah,
thing,
you
something
said it
else
well.
I can't pronounce. Have you heard of the magnetic chair? Salud talent audio. I don't know what that is. And shock therapy. I'm really curious of.
So it's new, like the shock therapy stuff. Again, not enough evidence to prove it's clinically effective. It just like medications, it might help someone, but we really just don't know how and by what mechanism. So it just varies. So I don't even have enough to tell you anything about it other than it's probably really expensive, and
Most all these miracle cures are, and I
yeah,
think that's what I think,
yeah,
that, like, just like an Apple product, right? Like, people expect more from something more expensive, and if
hmm,
something's so expensive, they think it'll work. And it's like, I think that most companies, if they find a cure for something, they would jump on it. And it's not like this one magic person that no one's listening to, and he's, you
right.
know,
Right. Right. The magic isn't in the pill, it's not in a chair, it's not in another person, it's in you.
mm,
It's
mm,
in you. I mean, there comes a point where you have to trust your own body that it knows to get you well. And as when you let go of that expectation of somebody or something else fixing you, then that pressure comes off so much because it's just on you and things are going to get better, and like you don't put that responsibility in somebody else's hands, and it leaves you less frustrated with other people and blaming, like you're living a blame free life at that point, and you're owning your own responsibility and experiences for life.
that's like the best feeling in the world, when you just say, "Hey, I can help myself." And I
Yeah.
and I think that's, we were discussing this before. I think that's the problem. And once again, whoever's suffering through this, the reason why we're making these videos is that we're trying to shed some positive
Yeah.
light outside of here, and because all that negative stuff, it's all out there. But something that I want people to realize, that you can really help yourself. And
Mhm.
we don't know the cause. I mean, like,
Right.
like, it can be stemmed from somewhere else that's causing this pelvic pain. But if you know that stretching is going to help you, what's stopping you from continuing to stretch? Like, I saw people like, oh yeah, it helped me 30%, it helped me 40%, but I'm not 100% better, so I stopped. How does that make any sense?
Right. Right. Yeah, because unfortunately, again, we have answers in the palm of our hands from the internet, and there's this thing of instant gratification, whereas I expect things to be gone yesterday, and that's not
Yes.
the case. And we have to, as a culture, as human beings, we have to be okay with not getting things the way we want when we want them, and we have to be okay with uncertainty. We are not, you can't be certain of anything because things can change in a drop of a dime. Like,
Mm.
you can be walking down the street one day and like trip over something, hit your head, and you're gone. Like, it's just like, not to be like morbid like that, but I mean, it's just the truth. Like, uncertainty is out of our control. But as long as we start to get more comfortable with that, then we're not so like, like grasping onto and attaching to things being a certain way. And that again, it leads you to not being so disappointed when things don't work out. You're not like overly excited when they do. Because again, when you're overly excited, guess what? That feeling isn't going to last forever, and something's going to change that. And then you're going to be down again, and then you're going to be up again, and you're going to be down again. And it's like you're swinging from one end to the other extreme, you know? It's like if you maintain that balance and you maintain equanimity, I love that word, equanimity. It's just maintaining a mind of balance, you know? You're okay if it goes this way, you're okay if it doesn't go that way. But either way, you're going to be okay. That's it.
I think that's the thing that I want people to realize, and I haven't been searching for anything recently. Like I haven't really thought about my I get very rare flare-ups, and truth be told, I don't stretch the way I should be stretching, and I'm jogging every day. I'm not lifting weights as much as I used to, and it's more lack of time, but like I feel better, and I hate to say it, like I get messages from people and people are just like, I'm still bad, I'm like, it's really a mind frame. Like you can trick your mind into really making yourself better, and waking up and on the right side of the bed being way more positive is such a difference in it. I really wish I can bottle this and not even sell it, just give it away to people, because
I know.
you know, and remember guys, we're just trying to set positivity. If you don't agree with our stuff, that's cool. I don't mind it. Like, we're here to have a discussion, but please be respectful of other people, because there are people who are suffering, and they really need our help, you know?
Right. Yeah, absolutely. And well said, Mike. Thanks for saying that. That's really good.
I think that's the way it is. I think we're done with the questions, right? I was trying to think if I had any more. If you guys have any more questions, we're gonna do this once a month or once every 2 months. But something that I did notice, the questions do repeat. So if anybody says a question, I'm just gonna link you back to these videos. We hope to have more people to come. These seem to do well. So remember, we're not doing this for any money. I have never made any money from YouTube. Dr. Susie has not given me anything. We've become really good friends more than anything else. It's always great to talk to her. And this is really just to have positivity out there. What's really crazy is that there's so many people like, oh yeah, you guys are on forums and stuff. Like, people are really posting it. So, you know, guys, keep the positivity up there. If you have any good stories, post your good stories.
Post the good stories.
You know,
that's right.
Not just the negativity, because it is draining. Honestly, if you're too negative, I don't pay attention to it, because it's too much.
Yay.
So
on that note,
anything else to add? All right. So we'll see you guys next time, and we'll see you guys next month. Any questions, leave it down below. See you guys.
Bye.
And it's